In 2021, Laurence Beesley had an open-heart surgery, with everything except the kitchen sink. In his heart, a benign tumor called myxoma was removed. Everything seemed to go well. Soon, 75-year-old Mr. Beesley was walking up to 5 kilometers from a great effort. The next day, on his way home from lunch, his energy evaporated and had great difficulty in walking. The problem was officially a leaked tricusptic known as tricuspid valve failure. I've never heard of. The tricuspid valve controls blood flow to the lower right room of your heart. When blood-leaking tricuspid valve leaks back to atrium, your heart must pump harder to move blood from valve and circuit. This leak causes intestine to accumulate in vital organs, including kidneys. It's a miserable situation that can kill you slowly. And if tricuspid valve, sometimes called the forgotten valve, reason is that there's no good treatment when leaking. How do you repair it? Associate Professor Tony Walton is an Alfred-based interventional cardiologist in Melbourne. Dr. Walton told Mr. Beesley that there were 3 options. First, there was an open heart surgery. In the case of Beesley, this was impossible. More than 50 years ago, he became ill with Hodgkins disease and was treated with full-body radiation. 2021 open heart surgery had essentially used its quota. The surgery is relatively high and it is not always useful, he said. Patient species tend to be older and more risky. Dr. Walton said that he had sent hundreds of patients for different conditions in the last 10 years. Maybe 5 of them were an attempt to repair a tricuspid valve. The second option was prescribe Mr. Beesley Diuresics to limit liquid holding, but otherwise he would have lived with him. The third option was an experimental surgery called a handful of times in Australia. Mr. Beesley will be the first to try it in Victoria. New surgery for about 10 years, a leaked mitral valve was increasingly treated with a minimal invasive procedure. This contains a catheter placed on the leg or chest and directed to the heart. The valve is replaced or repaired by access. Finally, a similar procedure for the repair of tricuspid valve was successfully tested in the US and Europe and is slowly handled in Australia. To repair tricuspid valve, patient has a general anesthesia and catheter is passed through femoral vein in groin and proceeds to right side of heart. In case of Mr. Beesley, loose wings of valve were cropped with a device that allowed valve to be opened and closed properly. Mr. Beesley hit the treadmill. The surgery took place about 8 months ago. Laurence Beesley has been happy to inform you that the quality of life has healed significantly. I could not run before all of this. He is also happy to declare that the liquid holding is reduced. I have a thin ankles again, he says. In the meantime, Dr. Walton has a patient who refuses to be sent home from the hospital until he is treated or so. We evaluate whether the new procedure is suitable, he said.